Welcome everyone. We're going to be talking today about the cranial nerves, which can be a very interesting topic. Now for those of you going into healthcare, it's going to be really important that you understand what the cranial nerves are all about. And today I'll be talking to you about neurological exams that you probably already had. You just didn't know that they were testing for cranial nerve damage. Now the cranial nerves are found in your peripheral nervous system. A lot of students try to put them in the CNS because they think that cranial, they're referring to brain, so they want to put it in the CNS. But looking on this picture here, you're going to see cranial nerves, spinal nerves are both in the peripheral nervous system. Your CNS only has two things in it, brain and the spinal cord. And if you think back to what the definition of a nerve is a bundle of axons in the peripheral nervous system. So, cranial nerves are found within the PNS. Now you're going to have 12 pair of these nerves. You're going to have 12 that travel to the left side of the body, 12 that work on the right side of the body. So total, I guess, 24. But we always think of 12 cranial nerves. Now, what you need to focus on as you study this is learn the number of the cranial nerve. You need to learn its name. It will have a number and a name. You need to learn the function, what it's going to do. Is it sense of smell? Is it the sense of hearing? You also need to focus on what its function type is, whether it is a sensory nerve or a motor nerve, and yes, some of them can be mixed. So go back and make sure you understand what a mixed nerve is, and think about what sensory means. Sensory, of course, means that something is picking up information from the environment, pain, temperature, pressure, whereas a motor neuron is taking information from your brain to an effector organ. Usually it's easier to think of muscles, think of movement. So we're going to be talking about all these different things, plus I'll be giving you some examples of neurological exams as we go. Now number one, this one is your olfactory nerve, and we're dealing with the sense of smell. This one will be a very simple one to remember. It is all sensory. There's no motor function. So we're dealing just with the sense of smell. It's also very easy to find. It looks something like a antenna for a little alien guy here. It's going to have a tract with a little bulb on the end of it. So what happens is you have nerve receptors that are in the nasal mucosa, the roof of your nasal cavity. They're going to react to sense odors in the air, take that information up through the little tiny holes of the cribriform plate in the ethmoid bone, and those will go into this little bulb, olfactory bulb, which then takes it back to the brain to be processed. And of course, if you have a neurological exam, you're going to have the patient try to smell something really easy to smell, coffee or a perfume. Okay. Now number two is our optic nerve. Okay. Obviously this is dealing with our sense of sight. So a neurological exam for this would simply be a standard eye chart. See, can they read the chart? Are they seeing? So information is picked up from the eyes. Visual stimulus will come in here. The optic nerve from each eye is going to travel back to something called the optic chiasma. And chiasma simply means a X or a cross shape. So it's going to be very easy to identify because there's this X-looking shape. Some of the fibers from your left eye will travel over to the right side. They're going to go back to the thalamus. Then information will go back to the occipital lobe, in the very back of the brain for interpretation. Okay. Number three is something called the oculomotor nerve. Oculo is referring to eye. Motor, of course, is referring to movement. So you can think of this cranial nerve as the eye mover. It's all motor function. We're talking about a nerve that's going to innervate or stimulate the muscles of the eye to move. The globe of your eye has 6 little tiny muscles attached to it that are going to pull it different directions. You're going to be able to look up, down, all different directions thanks to these little muscles. And they're going to pull it in the different directions. So you'll have one muscle attached to this eye that will move it lateral, one that will move it medial, one superior and one inferior. Then you have a couple of others that are going to slightly rotate the eye and down. So your oculomotor is all involved in eye muscles, and it only does 4 of the 6 muscles. So the oculomotor is working with 4 of these. Now, this is a patient who's definitely having trouble looking straight ahead. The doctor is taking a peek at him. He says, look straight ahead. But one of the eyes is slightly off. Now, it's called strabismus if both eyes are not tracking equally. Now, sometimes this is a birth defect. This person might have been this way their whole life, but if not, then you're looking for a problem. You might have a patient who had a stroke. It might be a tumor pressing on a nerve, or they might have had some type of trauma, some injury to the head. So you want to do a full exam to see which of the cranial nerves have been damaged. In this case, you look at this patient, you're going to see a little bit of drooping around the eye here. Obviously, this eye is not looking straight ahead. So the muscle here that would turn this eye medially or into the center or the middle of the body is not getting a signal. So that means that the cranial nerve on this side of the brain, the right one that carries information to the muscles for this side, is not functioning. Because you remember, cranial nerves deal with which side of the body. So not only are you looking for function, but you're going to be able to tell which side, which particular cranial nerve has been damaged. All right, number 4 is called the trochlear nerve. Now this one only innervates one eye muscle, and it happens to be the superior oblique. This muscle is going to take your eye and rotate it and move it down and slightly out. Okay. So this particular one, of course, is all motor function for just one eye muscle. Now cranial nerve number 5, this is called the trigeminal. The tri part is referring to the fact that there are 3 large branches to this nerve. You have V1, V2, and V3. Now it is the largest. Okay. Now anytime you have something like largest, that's going to help clue you in on this particular nerve. It's an exception. It's a difference. So anytime you're learning a lot of information, you want to pick out things that make it easier to remember, like a description of this nerve. If the word largest is in there, it's going to key you into number 5. This is our first mixed one. This one contains information on sensory information coming into the brain, and it's also carrying information out to muscles. So we're going to see both with this one. Now, the sensory part is carried by all 3 divisions. V1 is going to be picking up information from top part of the scalp, around the eyes, around the nose, pain, pressure, temperature, all that information is going to be carried by V1 back to the brain. V2 is going to be picking up sensory information from mid-face, and that includes the teeth. So if you had a toothache, this information, the pain, would be taken back by V2. V3, the mandibular nerve, is of course picking up all the information from your lower jaw. And of course, if you have a toothache and you go to get numbed up, this is the nerve that's going to be anesthetized. Now, the only branch that carries motor is V3, and this is going to take information from the brain down to what we call muscles of mastication. Mastication is just a fancy word for chewing. Okay? You may be familiar with that already because masseter, that was one of the muscles that you learned about back in Unit on Muscles. That is this large muscle at the corner that's involved in elevating the mandible, which is one of the motions during chewing. So here we've got muscle fibers that are carrying information to cause your muscles to allow you to chew. All right, now I'm going to look at this picture and show you some of the easier ways to identify these nerves looking at a brain, either at a model or a diagram like this one. And luckily enough, it's very easy. They're going to be identified in order. Remember, we're dealing with left and right, so you're going to think about this as a half. 12 on the left, 12 on the right. Number 1 is going to come out first, and like I said, it's in order. You just need to be able to, a few identifying parts will get you in the right direction. Number 1, again, is very easy because it's got this strange shape. Looks like the little bulb with kind of like a little tennis racket. Number 2, your optic nerve, that's also very easy to identify if you know what to look for. You're looking for the X. Okay? The optic chiasma is right there. And these little stubs that are coming off, that's the optic nerve coming out. It'll end up going to the eye. Right below the optic chiasma will be the mammillary bodies in some, it's not showing here, but the pituitaries are right about in this area as well. Number 3, the oculomotor, is coming out right at the base of this large structure here called the pons. So the pons is a really good landmark to learn when you're dealing with the brain. It's going to be the easiest thing to first pick up. You'll be able to pick out a lot of different structures around it. So the 3 comes out right here between the midbrain and the pons. Number 4, the trochlear, is going to come out in order as you go along the side. Remember, this would also be 4 over here, on each side. Number 5, the trigeminal, your largest cranial nerve, is going to come out about mid-pons. And remember, it'll be very easy to pick out because it'll be the largest. And some of the brains in the lab, you'll be able to see the 3 divisions start to separate. So that will be our first 5. All right, number 6 is called the abducens. Okay? It is dealing with only one of the eye muscles. So again, it's all motor. It's moving just one eye muscle, the lateral rectus. So lateral, meaning that it's going to be the muscle that causes your eye to look over to the side or outside of the body, lateral. Now, here we have a patient who is trying to look in this direction. He's trying to look to his left, but he can do that with one eye. But by giving him a neurological exam, we're going to see that something has gone wrong. And we find out this patient did have a stroke, and he has damaged the left number 6. And we know that because when we ask him to look to his left, the lateral rectus is not getting any innervation. The muscle is there, but it's not getting a signal from that particular nerve. So in this case, he suffered a stroke where that particular area of the brain isn't getting enough oxygen, blood supply. I put this slide together for you so that you can see all 3 cranial nerves that deal with the eye muscles. You can kind of put this in a group and think about the fact there are 6 eye muscles, only 3 cranial nerves that are going to deal with them. Number 3, your first, the eye mover, is going to deal with 4 of the 6. Number 4, the trochlear, is going to innervate just 1, the superior oblique. And number 6 is going to pick up the lateral rectus. So if you take a look at this slide, this will help you as far as which are going to innervate eye muscles. Number 7 is called the facial nerve. So the name's going to really help us here. It's going to direct us, of course, to our face. Now we're dealing with muscles of facial expression. Okay? That's our motor function. Again, this is one of our mixed nerves. We're also picking up sensations from your tongue, in particular, taste. So the very third anterior portion of your tongue, all the taste sensations from there are going to be carried by the facial nerve. Now, this particular disorder, Bell's palsy, will help you see what the facial nerve is doing for us. This is a patient who has presented with slackness on one side of the face. When they smile, only one side is going to smile, the other side is going to still stay in the same position. If you look, you're going to see a droopy eyelid. The cheeks are going to sag. Of course, the edges of the lip are going to be turned down. And this can be due to either inflammation of the nerve, maybe a viral infection, could have been trauma, some type of injury. In some cases, they're going to repair on their own. You'll regain function. Some can be chronic or permanent damage. So Bell's palsy is going to be an interesting disorder to get you to associate muscles of facial expression. It can be a little confusing because number 5 dealt with sensory to the face. So pain is carried by something else. That's a different cranial nerve. This one is just the movement of the face. Okay. All right, number 8 is something called the vestibular cochlear. Okay. We have 2 parts to this nerve, and it's all sensory. This is our sense of hearing and our sense of balance. So for this particular test, you might have a patient walk a straight line, see if they can maintain their balance. Of course, you would do a standard hearing test, see if they can react on both sides to different sounds. Now, the cochlea is a snail-shaped little organ in the inner ear that is picking up sounds. It's going to react to vibrations in the eardrum. And that information is going to be picked up by this cochlear nerve, the part of the number 8 that's going to take sensory information back to the brain. Now, the vestibular nerve is picking up information from this vestibule and these semicircular canals And what they do is they basically react to head position, whether we're moving, rotating. So it gives us our sense of balance. So again, if you put both of these together, you're going to create number 8. And you're going to hear more about this when we get to special senses. We're going to talk a lot more about how we hear. All right, number 9 is something called the Glossopharyngeal nerve. Now, go ahead and pick up the meaning of this word glosso, because you're going to see it again. Glosso means tongue. Okay? Glosso is referring to the tongue. Pharyngeal, that's referring to your pharynx, the area of the throat. So we're dealing with 2 parts here, and this is a mixed nerve. We're picking up sensory from the 2/3 posterior part of the tongue. So it's taste from the back part of your tongue. Now, it's a nice fact that we've got 2 cranial nerves that are dealing with taste, number 7 and number 9. So if one nerve is damaged, you're still going to be able to taste your food. Motor part of this mixed nerve is dealing with the pharyngeal muscles. So you might want to think about this as the swallowing part of the function. So swallowing and taste are what we're dealing with number 9. Now, here's another thing that you probably had done at an exam. You've been asked to open your mouth, say ah, stick out your tongue. Well, at this point, they're going to focus on this uvula that hangs at the back of the throat. Now, this fellow here, he's had a stroke, and his uvula is not hanging straight when he says ah. Okay? His is deviating to the right. And what this tells us is that the right side is still functioning. It's still constricting. Those muscles are getting a signal. So they're dominating and pulling the uvula to the right. That's going to tell you that this left side is not getting a signal. So we have a problem with the left number 9. Okay? And again, we know he's had a stroke. All right, number 10, this is what we call the vagus. Vagus comes from the word vagrant. Okay? A vagrant is a person who has no home, no job, they wander around. So this particular nerve wanders through the body. He starts out up here and he goes to almost, it goes to all the abdominal organs. It goes to the lungs, the heart, the liver. He is in control of just about everything from the neck down. So this is our only cranial nerve that's going to travel below the level of the neck. So again, that's one of those exception kind of facts that needs to stand out. Now he's mixed, okay? Means he does a lot of different things. He's picking up sensory from everything in the thoracic and abdominal cavities, picking up all pain, sensory, pressure, all of those feelings. He is parasympathetic motor. Parasympathetic meaning that you are not in conscious control of this. Right? So we're sending information to all these organs, directing heart rate, breathing rate, digestion activity. So all of this is carried out by number 10. Right, here is a picture. We're going to be looking at the positions of 6 through 10. Again, remember we're dealing with half of the brain at a time, 12 on the left. We remember that one, it's our little antenna looking here. We see the cross, we see an egg shape, we know that's number 2. Number 3 starts out here, the base of the pons. 4 is here, 5 is our largest. 6, the key to finding the abducens is to find the junction between the pons, which is here, and the medulla oblongata, which is right here. Looks like the swollen starting point of the spinal cord, but it's actually the medulla. So 6 is going to be the first one. And always remember that you got this halfway point, that 6 is going to be on both sides. This will be 6 as well. But we're keeping to one side over here. So number 6 will start here. Number 7, your facial nerve, will come in order. Number 8, vestibular cochlear, comes out next. Remember, it's very simple. They're just going to come right out in order. Here's number 9. Here's number 10, the vagus. Now, only the last 2 are a little bit different, and I'll get to that in just a minute. But 1 through 10 are coming out in order right down the side. The only points that you have to pick up are where 3 come out and where 6 comes out. Okay? All right, number 11 is called the accessory nerve. It is all motor. It is sending information to the muscles of the neck area, your SCM and your trapezius. Now, one way to remember accessory is to think of a necklace or a scarf. Some women think of accessories, they think of those things. So when you're thinking of accessories, think of a necklace, scarf, and you'll think about this area of the body, and it'll trigger a thought about your trapezius, hopefully. So this particular nerve is a little different. It doesn't come out in one single form. It has these little rootlets that are emerging that will fuse together to form the eventual nerve that comes down to these muscles. And the other difference is that it's arising from the spinal cord, not the brainstem. So it's the only one that does this. Now, one way to test the function of this nerve is to put your hands on the patient's shoulders, ask them to shrug or lift their shoulders. And if only one comes up, then you know that the other accessory nerve may be damaged. You can also place your hand on the patient's face, get them to turn their head. If there's no resistance, then you have a problem on that particular SCM. Right, the very last cranial nerve is called the hypoglossal. And here's that term again, glossal. Glosso is referring to our tongue. Okay? So you'll think automatically about your tongue with this one. This is all motor. It is sending information for movement to the tongue during speech, during chewing. So, fairly easy one to remember. Here's our last part of a neurological exam that I want to tell you about. You ask your patient to stick out their tongue. This guy, he's trying to stick his tongue straight out, but he cannot do it. This is, of course, the same patient. We already know he's had a stroke. So his tongue is being deviated in this direction. So what that tells us is that, again, his right side is functioning just fine. Muscles on the right side of the tongue are able to constrict and push his tongue outward. The left side's not getting a signal. So the left cranial nerve, number 12, is not functioning, causing the right side to push it over to the left. So again, it's a good way to check the function of the patient's cranial nerves. All right. Here we are on position. Number 11, again, the accessory is a little bit different. It has these rootlets that are coming up out of the spinal cord, not the brainstem. All of these are going to fuse into what becomes number 11. It goes down to our neck muscles, right? Number 12, a little bit different. This is the only one that's really out of order. It is coming out midway in the position of the medulla. Remember, this is our medulla right in here. Pons is up here. So this one here that's out of position is number 12. Now there are some different mnemonics that will help you learn these in order. Your lab guide has a list of a couple of these. You can make up your own, whatever helps you. But you're going to take these and learn them in order. Whichever way that helps you the best, you can come up with your own mnemonic, anything that will help you learn these in the right order. Now, I hope you've enjoyed it, and thank you very much.